can you imagine healthcare without your doctor, the one who knows you so well? Unfortunately, many are closing their doors because of pressure from big government. I recently did a story on the topic earlier this week. You can view that on our website at cbnnews.com or on my Facebook page, Caitlin Burke, CBN News. But right now we have Dr. Peter Anderson on with us to go a little bit more in depth. He's the author of The Familiar Physician and the founder of Team Care Medicine. Dr. Anderson, thank you for joining us.
Thank you, Caitlin.
So, Dr. Anderson, one of the biggest complaints of primary care physicians is EMR, or electronic medical records. Now, you're actually an advocate. Why are you an advocate of EMR?
As our population has aged over these last 30 years, now the typical patient has 200 to 300 data points. They have 10 or 15 medications, 5 or 6 chronic diseases, and 5 or 10 different kind of symptoms. There's no way paper can take care of that. Basically, paper's archaic if you want to give competent care. For me to organize 200 or 300 data points to keep track of them, and then also to make that data available to hospitals, specialists, after hours, or when the patient travels, it has to be on the EMR.
So when doctors want to modernize their practice, what is it that you suggest that they do now?
The key is you don't put the doctor on the EMR. When was the last time you saw the judge get off the bench and go do the stenographer's work? You would destroy our judicial system if the judge took over the stenographer's work. And that's what we've done in medicine. As our primary care network has been overwhelmed, patients have gone without care, or care has been really expensive. And just to give you an example, if they can't see me for a cold, they go to the emergency room. For me, it could be a $100 visit. That's a lot of money. For emergency room, a cold costs $1,200. EMR is essential, but at the same time, if you don't use it right, it has the ability to destroy your practice, and the ones that lose the most are the patients. So I would say the very answer to that is the innovation inside the exam room.
So you've come up with Team Care Medicine. Tell me a little bit about that.
So I'm working 12 hours a day, I'm $80,000 in the red, and I'm turning away patients. I said, it doesn't make any sense. I've just got to get more efficient. And the nurse surgeon team in the OR, I said, how come I can't have a team like the surgeon does? If I had a team inside that exam room, I could change my exam room process, maybe see more patients, do it quicker, never expecting to improve care. And so I said, I told my nurse, you're going to stay in this visit the entire time, and I'm going to teach you to do everything that I don't have to do. I mean, I want to do what a physician does, but I do not want to do what somebody else can do. And so my nurses were scared, I was scared, we were desperate. 3 years later, I went home and told my wife. She had seen that our productivity had gone up. I was back up to 30 patients a day, so the finances were getting corrected. But 3 years after the change, I told my wife, I've never given this kind of quality. I was working less, I was making a lot more money, paying the bills, and I actually was enjoying medicine again. I'd truthfully fallen in love with medicine again.
Dr. Anderson, thank you for being with us. The Familiar Physician is available on Amazon.com.